Hello, everyone. Happy Monday. My name is Shalaya Yazdi. I'm a public health practitioner and a Master's of Medical Health Science student at Touro University. I'm passionate about raising awareness of chronic condition prevention, management, and treatment. My mentor, Dr. Jay Shrubrook, and I created this webinar series to share wellness tools with our community and to raise awareness about chronic conditions, especially with an emphasis on diabetes. In November, our team discussed a variety of health and wellness topics such as nutrition, mind, body, spirit, and chronic condition management, prevention, and awareness. And given the incredible feedback from our audience last fall, we decided to expand upon these topics related to chronic conditions, especially for diabetes. Thank you so much for joining us to learn more about oral health and the link with diabetes. All webinars are or will be recorded and posted on our website at tu.edu/mobec/Zoom into Wellness. I would like to introduce Dr. Eugene Luna, the Associate Dental Director of La Clinica Vallejo Dental. I would also like to introduce EJ Bautista, a Master's of Medical Health Science student at Touro University. This evening, we will be discussing oral health and the link with diabetes. And if you have any questions, please feel free to enter them into the Q&A function of our Zoom webinar. Thank you so much. Let's zoom into wellness with Dr. Luna and EJ Bautista.
Thank you so much, Shalaya. So again, my name is Eugene Luna. I'm the Associate Dental Director of La Clinica Vallejo Dental. And my presentation today is titled Diabetes and Oral Health Considerations. Before I start, I'd like to thank Dr. Shrubrook, Touro University, and Solano Oral Health Advisory Committee for inviting me to present on this very important topic. Next slide, please. So some of the objectives that I have for this talk, number one, an overview of some of the effects of diabetes on oral health. Second, what are the dental treatment considerations for patients with diabetes? Third, I'd like to discuss a special project that we've been doing at La Clinica, which is diabetes testing being performed by our dental staff in 2 of our Oakland sites. And lastly, we should have plenty of time for Q&A. Next slide, please. So what are the effects, some of the effects of diabetes on oral health? First, we would see gingivitis and periodontitis or gum disease. On the left, it's a classic picture of what gingivitis looks like. A patient would present with red or inflamed gums and most likely would experience some bleeding when brushing and flossing. And this can further progress to the right side, which is gum disease or periodontitis, where tissue and bone supporting the teeth begin to break down. And as you can see, there is severe redness, bleeding, receding gums, and this could ultimately lead to mobility or even loss of teeth. Next slide, please. For people with diabetes, they're more likely to have periodontal disease than people without diabetes, probably because people with diabetes are more susceptible to contracting infections. And the interesting part of this is that research has suggested that there's a relationship between diabetes and gum disease that goes both ways, in that gum disease may make it more difficult for people who have diabetes to control their blood sugar. Severe gum disease can increase blood sugar, contributing to increased periods of time when the body functions with a high blood sugar, and this puts people with diabetes at increased risk for diabetic complications. Next slide, please. Another condition we would see is salivary gland dysfunction, xerostomia, or dry mouth. And we would see this due to underlying metabolic or endocrine problems. There is the decrease in saliva flow with alteration in saliva composition, which puts the patient at increased risk of developing cavities. Also inflammation of the oral tissues and inflammation in the tongue. And as a result of this, patients would experience difficulty in eating due to lubricating, biting, tasting, and swallowing. And this may contribute to impaired nutritional intake. Next slide, please. Another condition we would see is oral candidiasis, also known as thrush. And in this, a fungus, which is a constituent of normal oral microflora, however, due to salivary dysfunction, a compromised immune function, and salivary hyperglycemia, that provides a potential substrate for fungal growth. Those are the major contributing factors for patients with oral candidiasis or thrush in patients with diabetes. Next slide, please. Burning mouth syndrome. For this condition, no clinically detectable lesions are present, although symptoms of pain and burning can be very intense and uncomfortable. In uncontrolled or marginally controlled diabetes, some of the causes can include salivary dysfunction, candidiasis, and neurological abnormalities. Next slide. For Lycan Planus, this is a immunologically mediated process that involves a hypersensitivity reaction. And this affects mucous membranes inside the mouth, and it may appear as the white lacy patches that you could see in these two slides, or it can also present as red swollen tissues or open sores. And these lesions may cause burning, pain, or other discomfort. Next slide. However, contradictory results have been found when analyzing the relationship between Lycan Planus and diabetes. Diverse factors should be considered when studying this association for a correct interpretation of results. Next slide. And finally, we have acute oral infections. Because diabetes is associated with impaired wound healing, patients are at increased risk for oral infections. Next slide. So how do we manage patients that present with diabetes in the dental setting? Some of the general management considerations include patients should follow their usual regimen of meals, insulin, and/or oral hypoglycemics prior to their visit, unless advised otherwise. Systemic complications from diabetes, for example, high blood pressure, heart disease, kidney disease, the dentist is likely to consult with the patient's physician to discuss any modifications to the dental treatment plan, especially when surgical procedures are anticipated. We would also test the patient's blood sugar with a glucometer to avert emergency-related events, and we would sometimes do that before, during, or after an invasive procedure. And then finally, short morning appointments to reduce stress, and the reason being the release of epinephrine from stress due to stress can have a counter-regulatory effect on the action of insulin, resulting in stimulating the breakdown of glycogen in muscle and leading to hyperglycemia. Next slide. For adults with well-controlled type 1 or type 2 diabetes, we may have no more significant risk of experiencing oral disease progression than do those without diabetes, and hence can be treated similarly. Next slide. For patients with salivary gland dysfunction, xerostomia, or dry mouth, sometimes we would recommend saliva stimulation or replacement therapy, or to keep mouth lubricated. For surgical considerations for periodontal management, we would recommend to maintain a normal diet after the gum surgery to avoid hypoglycemia, and ensure effective repair. The dentist must review any previous history of complications, assess the patient's glycemic control, and maintain an ongoing dialogue with the patient's physician and nutritionist. We would recommend supportive periodontal therapy or maintenance cleanings to be provided at relatively close intervals. For example, 2 to 3 months, rather than the regular 6-month or yearly cleaning for regular patients. And finally, well-controlled diabetes generally does not require antibiotics following surgical procedures. However, the administration of antibiotics during the post-surgical phase may be appropriate, especially if there is significant infection, pain, and stress. Next slide. For oral disease management with steroids, steroids when treating lichen planus in diabetic patients can potentially put patients at risk of hyperglycemia. The patient should be given instructions to self-monitor blood glucose levels frequently during steroid therapy. Prolonged use of topical steroids for a period greater than 2 weeks continuously may result in mucosal atrophy and secondary candidiasis. Next slide. And finally, any undiagnosed dental patient who has the cardinal signs and symptoms of diabetes, that is excessive thirst, hunger, weight loss, or weakness, or who presents with an oral manifestation, for example, dry mouth or candidiasis, should be referred to a physician for diagnosis and treatment. And this is a good transition to the project that La Clinica recently undertook, which I'll describe in the next slides. So this special project, which is hemoglobin A1C testing of dental patients in 2 of our Oakland sites, a 15-month grant was awarded to La Clinica with the goal to reduce diabetes, dental caries, and related disparities by integrating diabetes prevention and control and oral health assessment. Our goal was to screen 1,600 patients for high, medium, or low-risk diabetes or pre-diabetes. Patients with a high or medium risk will be offered an in-office A1C test and will be categorized as normal, pre-diabetic, or diabetic. And pre-diabetic and diabetic patients will be referred to primary care provider for further testing and follow-up. Next slide, please. We provided a screening questionnaire with the medical history form during their dental visits, and the questionnaire consisted of 7 questions and were given to patients 14 years old and up. And based on the results of the questionnaire, we filed the patients under 4 categories. Category 1, they did not qualify for A1C testing. Category 2, they did qualify for testing but declined to be treated. Category 3 did qualify for A1C testing and agreed to be tested. And finally, category 4 did qualify for A1C testing and is a known diabetic. Next slide, please. And this is a screenshot of the questionnaire that we gave. It's very simple questions. How old are you? Are you man or woman? Gestational diabetes? Do you have relatives with diabetes, etc.? Next slide, please. The results we achieved from this project. So the total number of patients we screened was 1,032, which was a little short of our goal of 1,600, but still a significant amount. The total number of patients that were tested for A1C tested, 72, and the total number of patients that were referred to primary care was 17. Next slide. So the results that we achieved from the special project, we found that the screening initiative did add time to each visit and in some instances has made a visit run late. Some patients question why a dentist or dental provider is required to know this information and or why it is relevant. But this is an opportunity for teaching patients about the mouth and whole body connection. We had some patients who have a low risk score and did not qualify for routine A1C testing, yet requested testing to be completed for their own knowledge. And because of that, we needed to order more supplies to keep up with a greater number of tests being performed than anticipated. But we also saw this as a positive as patients are more aware of their health. And finally, again, because of COVID shelter in place, it set us behind our goals. Again, our goal was 1,600. We achieved 1,032. So in the end, we felt that this was a successful pilot project. Anecdotally, we would hear about patients that see their dentist much more than their primary care provider. If one of those 17 patients that we referred for further evaluation to primary care was like that, then we potentially did something great, really great for their health. And because this was successful, we are looking to possibly expanding the project to our Vallejo dental location. Next slide. And we have plenty of time for Q&A. I'd like to thank Dr. Shubrook, Touro University, for providing me this opportunity to reach out to our community to share the importance of diabetes and oral health. And we should have plenty of time for Q&A, and I could try to answer to the best of my ability. Thank you.
I would like to inform everyone in the audience that there is a Q&A function at the bottom of your screen. You may ask any question you like, and there is an option for it to be anonymously asked. So please feel welcome to ask anything that is on your mind related to oral health, diabetes, or Dr. Luna's presentation. And actually, one of the first questions we have is, how would I know if my oral health is affecting my diabetes?
How would you know if your oral health is affecting your diabetes? Well, first of all, as mentioned in my presentation, it's really important to have that regular exam with your dentist. We would check the condition of your teeth, check the condition of your gums. We would screen if gingivitis or periodontitis is present, and we would provide you an appropriate treatment plan to address that. In addition to that, we would recommend more frequent recall visits for the hygiene, and that way we can, evaluate you, make sure none of those conditions that I presented are being present. But the most important thing is preventive, making sure that the gums are as healthy as possible. There's minimal plaque, calculus, tartar buildup that can allow for those conditions to arise.
Thank you, Dr. Luna. Going off of that, where may people access dental coverage if they do not have insurance, or specifically in Solano County?
Definitely. So I would recommend, if patients do not have any dental coverage, to first contact Medi-Cal, see if they would qualify for their insurance, and therefore they would be covered that way. Some of the community clinics, like La Clinica, do offer a sliding scale fee, discounted rates based on income level. So if patients don't have that insurance, they can still be seen at a discount. The other options, contact CDA, see if there are any other resources for the patients as well.
Thank you. Going off of the previous question about how oral health and diabetes may be connected, I know you were talking about preventing plaque buildup and the like. How do you suggest people on a daily basis go about that? How often should they brush their teeth? How often should they floss, etc.?
Oh, definitely. So for any patient in general, we always recommend to brush at least twice a day, morning and night, and to floss. For patients at increased risk, with diabetes or patients with active gum disease, sometimes we recommend more frequent, after every meal, for example, just to minimize any of the plaque and food particles that are on the teeth that can exacerbate that condition.
Thank you for answering that. Another question from one of the participants in our audience is, what dental problems might they see if they do see those signs that you had discussed in your presentation? At what point would it be serious enough to go to the ER instead of maybe calling the dentist?
Right. ER, that would be more for, severe pain that's not being reduced by analgesics, infection, swelling, things that are, of course, emergencies, things that can't wait, basically. For all other things, I would recommend consult with your dentist, see what they recommend first. They can also screen and recommend ER at that point.
Okay, perfect. Another question that had been submitted is, someone had heard that you shouldn't rinse after brushing your teeth, but rather you should spit. How much of a difference does this make in terms of oral health?
Right. So I've heard of this too. The main reason being that the fluoride in the fluoride toothpaste is still present in the mouth. That is possible. Another option that patients can look into if they don't want that residual toothpaste taste in their mouth is to rinse and then follow up with a fluoride containing mouthwash, such as Act or Listerine with fluoride, something like that.
Thank you so much. And so there's one more question I see. People are asking at what point, if they are aware of the symptoms you had talked about in their oral health, when should they go to the dentist versus going to the doctor if they know they also have diabetes?
Symptoms such as what, for example?
The question did not ask any specifics, but I guess maybe redness in the gums or anything.
Sure. So I would advise that if it's dental related, if you feel that it's affecting the teeth, by all means, definitely go to the dentist first. Again, if the patient is experiencing severe pain that I was mentioning earlier, extending, to the palate, things like that, consult with your physician. However, if a patient does present with some of those conditions in the dental office, we would be able to evaluate and either treat or refer accordingly after that.
Okay, and preventatively, how often should people go to the dentist in your recommendation?
Yes, so we always recommend at least once a year. So definitely once a year for patients that have diabetes, that have other conditions that the dentist is following closely. As mentioned in my presentation, sometimes we recommend every 2 to 3 months for the follow-up cleaning, just to minimize the plaque buildup, the tartar buildup, things like that. But at the very least, every year.
Perfect. And just as a reminder, one more time for the audience, may you please also inform them where in Solano County may they access dental care?
For patients in Solano County, again, I would recommend reach out to Medi-Cal, first of all, see if you have the coverage. There are several community clinics in Solano County, again, Clinica Vallejo Dental. There's a Solano County Dental Clinic. We have Ole Health in Napa as well. There are several options as well. There are some providers that also take Medi-Cal, and you can reach the Medi-Cal website and you'd see a list of providers also that take that insurance.
Perfect, thank you so much. As of right now, we have answered all of the questions in the Q&A from the audience. I am unsure if Shalaya would like to say any words.
Thank you so much, Dr. Luna. Thank you so much, EJ, for moderating this discussion. I really appreciate the importance of this topic. It's incredible information that we all need to learn more about and share with our friends and family members. So again, thank you, Dr. Luna and EJ, for this incredibly informative session.
Thank you.
Have a good evening, everyone.